The U.S. Surgeon General says he wants to take on what he calls an epidemic of loneliness in the United States. Loneliness has been linked to a variety of health problems. Joining us now to talk about it is Dr. June McCoy from Northwestern Medicine. Doctor, thanks for being with us.
Thanks for inviting me.
Well, first of all, what does loneliness look like in terms of its effect on our health?
It looks really bad. If you think about the campaign we've had over these past few decades against smoking, loneliness actually hurts you more than smoking cigarettes.
How is that?
So
I
it's
heard the
almost like
Surgeon
smoking.
General make that point today. How is that?
Because loneliness actually will cause certain changes within your body. If you're isolated from others, you might not be eating, you get depressed. Depression leads to not eating, not sleeping, and all these things have a cascade effect such that your body changes negatively and you start getting certain diseases. Heart disease, for instance, the stress of being alone can actually cause internal changes that puts you at risk for a heart attack or a stroke and other diseases, other health conditions.
I know it's super easy to say, oh, get out, take a walk, socialize, join a community group, but for some, it's a lot harder than that. So how do we address this epidemic of loneliness?
Before I even answer that question, let's understand that although the Surgeon General came out with this concern and highlighted this issue, there is no, as far as we know, federal dollars being allotted to providing programs to combat loneliness. So what can we do? Certainly making sure that healthcare providers, doctors, nurses, social workers become more aware of this problem. And this will have to be done through the health systems, where hospitals and other facilities take up this mantra and run with it, because the federal government, although they seem to care, don't have money for this.
Yeah, and
And
it comes down
so
to money, yeah.
yes, it's a unfunded, somewhat unfunded. Um, you want to use the word mandate
Mandate, yeah.
because it's somewhat that,
Unfunded
but I
suggestion,
think
yeah.
unfunded suggestion. But I think really making sure that we, as healthcare providers at the forefront, we're seeing patients, that we're asking that question when they come to us. Make it be the sixth vital sign. We talk a lot about your blood pressure, your
Mhm.
heart rates, and your temperature, and so on. The next thing we should be asking, how are things for you? Do you feel lonely at times? It should become a normal part of your doctor's interview when you're going to see your doctor for your care. And that way we'll find out which people are suffering the most and maybe institute measures to combat this loneliness. And I can think of some if you've got the time.
Yes, we've got about 30 seconds left.
Okay, because I take care of older adults, I want to focus on older adults.
Hmm.
And I would recommend that older adults start making friends with people 10, 20 years younger than yourself, so that you're not left alone as you age, that you're aging with younger persons coming behind you. And I think through those kinds of connections, you will not be feeling that lonely, because you've got someone with you and you're able to call them or to meet up with them occasionally to kind of combat your feelings of isolation.
Yeah, it's such a serious issue. Many of us have dealt with it in our own families, and you do want to say, oh, just get out and meet people, but sometimes you have to have a little structure or be forced to do it. Dr. June McCoy from Northwestern Medicine, thanks so much for your insight. We appreciate it.
Thanks for having me.
Still to come here, newly released